Good morning, folks, to everyone. It's good to be here again. I want to start by thanking FDLI for inviting me to contribute to this really excellent program again, and for graciously also offering me an opportunity to begin this session by spending perhaps 5 minutes sharing some thoughts about my new role with what is currently still called the Foundation for a Smoke-Free World. I've worked with many of you over the years on major public health and regulatory issues related to tobacco and nicotine, and look forward to continuing our partnerships and collaborations to accelerate the end of smoking, which, as everyone well knows, remains the leading preventable cause of death in the US and also globally. So, on a personal note, from the very start, this cause has mattered a great deal to me and my family. My dad was a state representative. I was raised in Chicago, so he served in the Illinois legislature when I was growing up. And in the early 1970s, he had the foresight to introduce the state's first ever bill to eliminate smoking in public places. He was so far ahead of his time, it took only 19 years for some version of that bill to pass. But they thought he was, at the time, crazy. And one day, a fellow legislator expressed his displeasure by bouncing a lit cigar butt off the back of my dad's head. But in fact, my dad wasn't crazy, and he was just ahead of his time. And along with my mother, whom I also want to honor, who was a social worker and a political activist who collaborated, among other things, with the Reverend Jesse Jackson on social justice issues. They both served as wonderful models for their eldest kid. On another personal note, like far too many of you, I also lost a close family member to smoking, my only uncle, who passed away from lung cancer. So after 35 years working as a public health advocate, teacher, government advisor, attorney, and researcher devoted to the cause of tobacco control, 2 weeks ago today, I moved to a new role that gives me a greater platform to be a voice in accelerating the end of this epidemic. And I'm very pleased to have been named the new president and CEO of the Foundation for a Smoke-Free World, whose name and brand will be changed in the coming months to reflect our increasing, enhanced, and I think excellent public health focus. So in that regard, please stay tuned. We're going to continue funding carefully targeted, innovative research, and importantly, engage in increasingly robust educational and communications efforts dedicated to improving the understanding of millions of people to help them live healthier and longer lives. I also want everyone to be aware of some basic important facts about my role and this evolving organization. So let me begin by emphasizing as clearly and unambiguously as I can, the Foundation has now completely ended its relationship with Philip Morris International, or PMI, after receiving what I characterize as a final severance payment. Many of you know me, and you won't be surprised that I worked hard over many months to effectuate this unprecedented change, without which I would not have considered accepting this role. And I want to honor the members of the organization's board of directors, whom I hope you will get to know, all of whom are entirely independent, for having the commitment and the vision to work with me in making this happen. So I'm delighted to move forward with this life-saving work while seeking new non-tobacco partnerships to pursue our shared public health mission. The original pledge agreement, which raised concern for some observers, has been terminated. It is gone. And let me state this as clearly as I can. As the organization's leader, I will never seek or accept any further tobacco industry funding, period. We're at an inflection point now, where we have a new chance to strengthen our relationships and engage with a wide variety of organizations to save lives through the promotion of a menu of strategies, scientific policy, to end smoking, including traditional tobacco control policy and cessation interventions that I've worked on from my first day in this career 35 years ago when I led the coordination of the national campaign to remove smoking from airplanes. I've been around here that long, it's true. And also to focus on science-based harm minimization approaches. We agree with Brian King and the FDA that the continuum of risk across different tobacco and nicotine products is both real and critical to public understanding and hoped for behavior change. And we're going to seek to share this information with the public and clinical communities with a great deal of invited input from my public health community, which I still am very much a part of, at the same time that we address the additional priority of protecting youth. As always, we're going to continue to make good decisions about funding capable and experienced researchers, and I have no doubt that we can do a great deal of meaningful and impactful work with more than $100 million dedicated to these public health objectives, and particularly with a focus on the social justice needs of disadvantaged populations with the highest rates of smoking and risk of illness and early death. We're not going to back down or shy away from tough decisions or meaningful work that's going to advance this cause. And I'm going to be standing with the many people and organizations present here and tuning in virtually who are devoted to this cause of accelerating the end of the tobacco epidemic. So I look forward to linking arms and winning this war. And by the way, in case anyone is wondering, although I'd be surprised if you are, I'm 65 years old. And I just figured, rather than get on Medicare and retire, I'd do this. So thanks again for the privilege of your time. I want to thank the panelists for their forbearance as I came up to start this session. And again, I do invite you to consider partnering in any ways that you may be interested in doing with us based on our shared interests and priorities, and to not rely on what I say, but to please watch what we do.